Okay, imagine this. You
Mhm.
step out into your pasture, and there's a cow just lying there.
Yeah, no obvious reason.
Exactly, no warning signs. Or maybe you spot others, stumbling a bit, twitching, looking completely, well, disoriented.
It's a really frightening scenario for any producer.
It absolutely is a farmer's worst fear, right?
Yeah.
But for us, it's also a genuinely compelling look into just how delicate the balance of life can be
Mm-hmm.
and how tiny mineral imbalances can, well, just unleash these massive, rapid, and often fatal impacts.
It's a profound illustration, really. Shows how even the most robust-looking animals are still fundamentally vulnerable to their basic physiological needs.
Absolutely. And today we're taking a deep dive into a condition known by, well, a lot of names. Hypomagnesemic tetany.
Right.
You might have heard it called grass tetanies, maybe grass staggers, lactation tetany,
Yep.
spring tetany, even wheat pasture poisoning or winter tetany.
Lots of labels for the same core problem.
Exactly. But at its heart, it's a metabolic disorder driven by dangerously low levels of magnesium in the blood and the cerebrospinal fluid of cattle.
Essentially, it's a sudden metabolic crisis. Yeah.
So our mission in this deep dive is to take this stack of sources. We have scientific bits, comprehensive guides, all sorts, and really distill the most important nuggets of knowledge for you.
Okay.
We're going to try and unpack what magnesium actually does for cattle, explore the complex reasons these deficiencies happen.
Which can be quite varied.
Right. Understand the range of symptoms, from the subtle stuff to sudden death. Learn how it's diagnosed, what treatments work, and maybe most importantly, how to prevent it.
Prevention is definitely key with this one.
We'll even touch on some pretty surprising recent research that connects prevention to other health risks. So think of this as your essential shortcut, getting truly well informed on this critical, often hidden challenge in animal health.
The challenge that affects herds worldwide. Absolutely. Grasping its complexities is truly vital.
Let's start with the basics then. We know magnesium is vital, but what exactly is it doing inside that cow's body that makes its absence so catastrophic?
Well, what's fascinating here is magnesium's fundamental physiological role. It's absolutely crucial for nerve conduction, muscle function, even bone formation.
Okay.
But maybe its core job is to act as an electrical suppressant for nerve and mobile activity.
An electrical suppressant.
Yeah, think of it like the dimmer switch, maybe, for electrical impulses throughout the body.
Ah, I like that analogy.
So when magnesium levels drop too low, that suppressive effect is lost. And that leads to uncontrolled neural firing and muscle contractions, which directly explains the hyperexcitability, the seizures you sometimes see.
So it's not just about energy, it's about controlling the whole system, sort of dampening down the electrical chatter. That makes perfect sense for those stagger symptoms we hear about.
Exactly.
Does it work independently, or is it, tied up with other minerals?
That's a great question. If we connect this to the bigger picture, magnesium is also really integral to calcium metabolism.
Okay.
It's necessary for the hormones that help absorb calcium and mobilize it from bones.
All right.
So this means hypomagnesemia, low magnesium, is frequently accompanied by hypocalcemia, which is low blood calcium.
Ah, so they often happen together.
Very often.
Yeah.
And this concurrent deficiency can really exacerbate the clinical signs, make things look worse, and complicate treatment. It's why you'll often find combined calcium and magnesium solutions used for emergency care. It's like a synergistic metabolic disturbance.
Wow, that's a powerful connection. So if magnesium is so crucial, why do these deficiencies happen? It can't just be zero magnesium in the feed, right? And it sounds like there's more going on.
You're absolutely right. It's rarely that simple. It's usually a complex, multifactorial issue. Let's start maybe with dietary imbalances.
Okay.
Lush, rapidly growing grass, particularly in spring or fall, is often just inherently low in magnesium itself.
Even if it looks really healthy, green and lush.
Exactly. Looks can be deceiving. Forages with less than, say, 0.12% magnesium are considered tetany prone. Ideally, you want to see levels between 0.2% and 0.25% to feel safe.
So that green pasture could actually be a hidden danger zone.
Precisely. And this is where it gets really interesting. It's not just the low magnesium content itself.
Oh.
High levels of potassium K+ and nitrogen N+ in those same lush forages significantly interfere with magnesium absorption from the rumen wall.
Whoa, wait, so other minerals block it?
They absolutely can. There's a widely recognized risk factor.
Yeah.
If the potassium to calcium plus magnesium charge ratio in the forage gets above 2.2, that signals high risk. So yeah, the presence of other minerals can literally block the uptake of the magnesium that's there.
That's a critical detail. It's not just about what's present, but about what's actively blocking what's needed. That changes things.
It really does. And get this, some grasses even contain a natural compound called transaconate.
Transaconate.
Yeah, and it directly complexes with magnesium, basically grabs onto it, making it unavailable for absorption by the animal.
Wow, so the plant itself can make it unavailable.
And low dietary sodium is another factor, because sodium is also needed for efficient absorption. This also ties into winter tetany.
You mentioned that name earlier.
Right. That specifically links to a chronic energy shortage and insufficient magnesium, often seen when cattle are fed certain types of cereal grain silage that happen to be high in potassium and nitrogen.
So it's definitely not just a spring pasture problem. How much do the soil and the environmental conditions, like where the grass is grown or the weather, how much do they contribute?
Oh, a great deal. The condition is really common in late winter or early spring, think February to April or sometimes in the fall, on that rapidly growing lush grass or young cereal crops like ryegrass or wheat.
Young plants specifically.
Yeah, young plants naturally have lower magnesium compared to more mature forage or legumes like clover. Then you add in factors like waterlogged soils, cool weather. These things hinder the plants from taking up enough magnesium from the soil in the first place. Acidic soils don't help either. High potassium levels in the soil, or maybe inappropriate potassium fertilization, makes it worse. And heavy nitrogen fertilization. It promotes that lush growth, sure, but the plants themselves can end up low in magnesium.
It really sounds like a potential perfect storm of conditions all coming together.
It often is.
And you mentioned environmental stressors earlier. Are these actual causes of the deficiency, or are they more like triggers?
That's a really critical distinction. They are definitely triggers.
Okay.
These stressors precipitate or kick off the acute signs in animals that are already vulnerable because they've been eating low magnesium forage for a while.
So the underlying problem is there, waiting.
Exactly. Common triggers, things like cold, wet, windy weather, heavy frosts. But really, any stress can spark an outbreak.
Like what kind of stress?
Ostress, being in heat, which can reduce feed intake, mustering, yarding, trucking, even just short periods of starvation if they're moved or feed isn't available. Essentially, anything that reduces their feed intake directly limits that crucial daily magnesium supply the animal desperately needs at that point.
Okay, that makes sense. The vulnerability's already there, simmering, and then stressor just pushes them over the edge.
Yeah.
Which animals are most susceptible? Is it just about milk production, or?
It's primarily seen in older lactating beef and dairy cows, yeah. Particularly about 4 to 8 weeks after calving.
Peak lactation, basically.
Exactly. That's due to the incredibly high magnesium demand for milk production. But here's a really, really important aha moment.
Okay.
Unlike calcium, cattle cannot readily mobilize or store significant magnesium reserves from their bones or soft tissue.
Really? No reserves?
Very limited. They continuously lose magnesium in milk, urine, feces, so they require consistent daily intake. This makes them entirely dependent on their diet each day for the magnesium they need.
Wow. So no internal reserves to fall back on, like with calcium. That fundamentally changes how you think about prevention, doesn't it? Constant daily intake is just non-negotiable then.
Precisely. It has to be a continuous supply.
Yeah.
And it's not just cows. Calves can get milk tetany.
Milk tetany.
Yeah, typically affects beef calves maybe 4 or 8 weeks old, or dairy calves 2 to 4 months old if they're fed only milk, or sometimes younger calves if they've had chronic scours, losing electrolytes.
What makes them vulnerable?
What's critical for calves is that their ability to absorb magnesium actually decreases significantly as they mature. It goes from like 87% absorption efficiency at 2 to 3 weeks old down to maybe 32% at 7 to 8 weeks.
That's a huge drop.
It is. And it makes them susceptible right around the time they're transitioning from milk-based diets to more solid feeds.
Interesting. Any breed differences?
Yeah, there seems to be. European breeds, like Angus, for example, are generally thought to be less tolerant. Breeds like Brahman and their crossbreds seem to be more tolerant. And unfortunately, animals that have had tetany once are definitely prone to getting it again.
Right, a history makes them higher risk. The vulnerability profile is so specific. Given how fast this can apparently progress, what does it actually look like in an animal? What are the signs from, the subtle hints to that devastating sudden death?
Well, that's the terrifying part. This is truly a silent killer sometimes. Sudden death is a very common and devastating presentation, especially in those older lactating beef cows out on pasture.
Just found dead.
Often, yes. Found dead without anyone having seen prior signs. Maybe there's disturbed ground around them, suggesting some terminal seizure activity. But that's it.
Wow.
It really underscores the critical importance of prevention, because by the time you see something obvious, it might genuinely already be too late.
That's incredibly sobering. But are there earlier, maybe more subtle signs? Is there like a subclinical form?
Yes, absolutely. There's a subclinical or chronic form. It's milder, often unrecognized.
What happens then?
Blood magnesium concentrations are lower than normal, maybe between 1.1 and 1.8 milligrams per deciliter, but not yet critically low. The signs can be vague, maybe reduced feed intake, they seem a bit nervous or jumpy, decreased milk production, some wasting or poor condition, maybe anemia.
So not dramatic, but still impacting performance.
Exactly. And this represents a substantial hidden economic burden beyond just the dead animals. Because these animals are less productive, less efficient, but they're not showing those overt, dramatic signs of tetany.
So it's quietly eroding the herd's performance and the farm's bottom line in ways that might not even be immediately obvious.
That's a very good way to put it.
Okay, what about the acute disease, when things really go wrong quickly?
In acute cases, the progression is rapid, typically over, say, 12 to 24 hours.
And what are the first things you might notice?
The earliest signs often include muscle twitching fasciculations, they're called, especially around the face, shoulder, or flank. The animals appear nervous, restless. They might have a startled expression, an exaggerated blink reflex, maybe grinding their teeth.
Okay, getting agitated.
Yeah, they might even become aggressive. Their gait becomes stiff, unsteady. They often hold their head high, have this wide-eyed stare.
That sounds pretty alarming, and then it progresses even further from there.
It does. As magnesium levels continue to drop, you start seeing sustained muscle spasms, actual staggering, and then falling.
They go down.
They go down. Once they're down, they might be recumbent, lying flat out, or sometimes with a characteristic S-bend in their neck, or their head pulled tightly back against their chest. You might also see gut stasis. The rumen stops moving, which can lead to bloat and constipation.
And then the full-blown seizures, the things we often associate with the term staggered.
That's the advanced stage, yeah. Animals exhibit this frenzied paddling with their legs, sudden jerky eye movements, chomping jaws, frothy salivation.
What causes that specifically?
That's the critically low magnesium in the cerebrospinal fluid, the fluid around the brain and spinal cord. When it gets below about 1 milligram per deciliter, that's directly responsible for these severe neurological signs. They might lie with their head arched way back, a position called episotenos.
And the terminal stage.
In the terminal stage, there's just extreme physiological stress. Heart rates can shoot up to 150 beats per minute, like twice normal. Respiration gets rapid, maybe 60 breaths per minute. Body temperature can climb as high as 105 degrees Fahrenheit, purely from all the excessive muscle activity.
That's intense.
It is, and death often results either from ruminal bloat, because the rumen isn't functioning, or from paralysis of the respiratory muscles. They just can't breathe anymore.
It paints a vivid and frankly terrifying picture of what the animal goes through. So if you suspect this is happening, how is it actually diagnosed? It sounds like there's absolutely no time to waste.
You're right, time is absolutely of the essence. Often, a presumptive diagnosis is made right there in the field. Based on the clinical signs you see, the animal's history, is it a lactating cow on lush pasture? And, importantly, a rapid positive response to magnesium treatment.
If you treat it and it gets better fast, that's a good sign it was tetany.
Exactly. But just relying solely on that response can be a bit risky, because other conditions can mimic tetany.
Right. So how do you get a more definitive answer, ideally while the animal's still alive?
For a definitive diagnosis in live animals, blood tests are key. You're looking for low serum or plasma magnesium levels, specifically below about 1.1 or 1.2 milligrams per deciliter.
Okay, blood test. Simple enough?
Well, there's a potential pitfall.
Oh.
Muscle damage from severe convulsions can actually cause magnesium to leak out of the muscle cells and into the bloodstream.
So it could look falsely normal.
It could look falsely normal or even high right after a seizure. So ideally, samples should be collected before you administer treatment, if possible.
Good tip. Anything else?
Urine tests are also very reliable. During tetany, the kidneys work overtime to conserve magnesium, so it's typically completely undetectable in the urine. That's a strong indicator.
Okay.
And you should always check calcium levels too, because as we said, hypocalcemia often goes hand in hand with it. Low calcium, below 8 milli-GDL, is common.
Makes sense. And for those devastating cases where the animal is found dead, how do you confirm it was tetany then?
Yeah, postmortem diagnosis is crucial for those sudden death cases. Cerebrospinal fluid, the CSF, is useful. If the magnesium level is below 1 milli-GDL, that's highly indicative. But the sample needs to be collected fairly quickly, ideally within 12 hours of death.
CSF within 12 hours. What if it's longer?
Even better, actually, is the vitreous humor, the fluid from inside the eye.
Yeah, eye fluid, really.
Yeah. Magnesium levels there are also indicative if they're below 1 milligl. And the big advantage is that it's much more stable after death. It can remain reliable for 24, even up to 48 hours post-mortem, especially if the ambient temperature is cool, say below 23 degrees Celsius or about 73 Fahrenheit.
That's a really clever way to get stable results later on.
Yeah.
Eye fluid, good to know. What else could it be that might look similar, making the diagnosis tricky?
Oh, yeah. The differential diagnosis is critical. You have to rule out other possibilities.
Like what?
Things like acute toxic mastitis can cause cows to go down quickly. Lead poisoning, especially in calves, can cause neurological signs. Tetanus, botulism, other neurological issues. Even severe acidosis or, believe it or not, lightning strike can sometimes present with sudden death or neurological signs.
So a careful process of elimination is needed.
Absolutely.
Okay, let's shift to treatment, the emergency response. What do you do when an animal is showing these acute signs, literally staggering or seizing right in front of you?
Right. Immediate action is absolutely key. Animals showing those clinical signs need emergency parenteral treatment, meaning treatment by injection, not orally.
Okay, injection. What kind?
Typically, this involves a slow intravenous the feet into the vein injection of a commercial solution that contains both magnesium and calcium.
Both, because
Yeah.
they're often low together.
Exactly. For example, a common treatment might be 400 milliliters of a 40% calcium borogluconate solution mixed with, say, 50 milliliters of a 25% magnesium sulfate solution. But here's the critical caution.
Yes.
It must be given slowly, really slowly, while monitoring the heart. Giving calcium or magnesium too fast, IV, can cause cardiac arrest, fatal heart problems.
Wow. Okay, slow feed, monitor the heart. That's serious. What if the animal's already convulsing violently? It might be hard to even get an IV in.
That's a very good point. If an animal's actively convulsing, initial sedation is often vital.
Sedation first.
Yeah, to stop the seizure. This helps prevent potential brain damage from the prolonged seizure activity, and it also protects both the animal from injuring itself and, frankly, the handler trying to treat it. You really don't want to stimulate an animal that's seizing while you're trying to treat it.
Makes sense. Any other ways to get magnesium in quickly?
Yes, subcutaneous administration, SC, under the skin is another really good option, especially for magnesium.
Under the skin, how fast does that work?
It can provide high blood magnesium levels pretty quickly, often within about 15 minutes. You can give magnesium sulfate solution this way, maybe 120 to 400 milliliters of a 25% solution for a cow, and it helps to massage the injection area well afterwards to help with absorption.
Okay. And for calves, smaller dose.
Right. For calves, maybe around 100 milliliters of a 10% magnesium sulfate solution given subcutaneously.
Got it. And what's the prognosis generally? How quickly do they recover, or is it often too late by the time they're down?
The prognosis is generally pretty good if they're treated within, say, 1 to 2 hours of first showing clinical signs.
That's a narrow window.
It is. However, recovery from hypomagnesemic tetany is typically slower than recovery from just simple hypocalcemia or milk fever.
Why is that?
It takes longer for the magnesium concentrations in the cerebrospinal fluid to normalize, even after blood levels come up. So the neurological signs can linger a bit. And if the animal has already been down, recumbent, for several hours before treatment starts, well, the prognosis becomes much poorer then.
Okay. So, given the speed, the severity, the narrow treatment window, prevention really does sound like the absolute best offense here.
Without a doubt. Prevention is by far the most effective approach. Treatment is often difficult, stressful, expensive, and sometimes just too late, given how rapidly this can progress.
So what's the strategy for prevention? Where do you start?
It really starts with nutritional management. You need to ensure adequate dietary magnesium intake day in, day out, especially during those high-risk periods.
What's adequate?
The target is generally around 0.35% magnesium in the total diet dry matter for dry cows, and maybe 0.28% for lactating cows. But crucially, you also have to address that interference problem we talked about.
The potassium and nitrogen blocking absorption.
Exactly. You need to counteract that, maybe by feeding high magnesium concentrates or offering good quality hay that you know has safe magnesium levels during those high-risk pasture periods. Dilute the risky stuff, basically.
Right, balance the diet overall. What about managing the pastures themselves? Can you make the grass safer?
Yes, pasture management is vital too. One strategy is to delay grazing those high-risk pastures until the forage is a bit more mature, less lush. Maybe wait until it's 4 to 6 inches tall.
Let it grow out of that really risky young stage.
Right. You can also supplement pasture grazing with dry forages, hay, or silage that have safe magnesium levels. Another tactic is to use those highest risk pastures for animals that are less susceptible,
Like who?
like steers or dry cows or maybe heifers, not those high-risk older cows in early lactation.
Save the risky fields for the tougher crowd.
Essentially, yes. And, as tough as it might be, consider culling animals that have had tetany before, because they are much more likely to get it again.
Okay. What about changing the pasture composition?
Absolutely. Planting legumes, things like clover or alfalfa within the pasture mix is beneficial, as they naturally have higher magnesium levels than most grasses.
Good point. Fertilizer management.
Crucial. Avoid over-fertilizing with potassium or nitrogen, especially potassium. Always conduct soil tests first to see what's actually needed. Don't just guess or follow a standard recipe. And some people find pasture topping, mowing the seed heads, can be beneficial too, maybe by encouraging leafier, potentially higher immature regrowth, or reducing the dominance of certain grass species.
These all sound like really smart, proactive steps. But if magnesium isn't stored in the body, like you said, consistent daily supplementation has to be the absolute cornerstone, right?
It absolutely is. That's the take-home message for prevention. Magnesium is not readily stored, so it must be supplied daily. And supplementation shouldn't just start when you see the lush grass. It should begin before the high-risk period.
How far before?
Ideally, a month or even more prior to expected high-risk periods, like before early spring turnout onto lush pasture or before a fall flush of growth. And it needs to continue until that threat subsides. Consistency is everything.
Okay, consistency is key. How do you actually ensure that consistent daily magnesium intake in a practical way, especially for grazing animals? What are the methods?
There are several key methods people use. Mineral mixes are probably the most common.
Free choice minerals?
Right, providing free choice supplements that contain about 12–15% magnesium, usually from magnesium oxide or MgO. The aim is to get about 10 to 15 grams of actual magnesium into each cow per day.
How much mix is that?
That usually works out to about 4 ounces, maybe a bit more, of a typical 15% magnesium mineral mix per cow per day.
Is MgO palatable? Do they eat it readily?
That can be a challenge.
Yeah.
MgO on its own can be quite unpalatable, dusty too, so it's often mixed with things like molasses or dried distiller's grains or offered in specifically formulated, prilled, or granulated forms to improve intake. And generally, loose mineral mixes tend to be consumed more uniformly by a herd than solid blocks.
Okay, loose mixes are better than blocks usually. What other options are there besides mineral mixes?
You can fortify the drinking water.
Adding magnesium to the water trough.
Yeah, adding soluble magnesium salts like Epsom salts, that's magnesium sulfate, or magnesium chloride to the water supply.
Yeah.
You have to be careful, though.
Why is that?
You need to get the dilution right. Too concentrated, and it could be toxic, or just make the water taste bad so they won't drink enough. Too dilute, and they don't get enough magnesium. Requires careful calculation and monitoring of water intake.
Tricky balance. What else?
Pasture dusting is another method.
Dusting the grass.
Yes, literally dusting the pasture with powdered magnesium oxide of about 60 grams per cow per day, usually early in the morning when there's dew, so it sticks to the leaves. The downside is you might need to redust it after heavy rain washes it off.
Sounds labor-intensive.
It can be. Treating hay is another option. You can spray a mixture of magnesium oxide and molasses onto hay before feeding it, or even add dry MgO powder during the baling process, though uniform distribution might be tricky there.
Okay. Direct dosing.
Yep. Direct administration is possible too. Drenching animals individually with magnesium oxide or Epsom salts mixed in water, or using slow-release magnesium boluses like rumen bullets.
Boluses sound convenient.
They can be, offering sustained release. And finally, for dairy cows especially, magnesium oxide can simply be added directly into their grain mix or total mixed ration, TMR. That allows for very precise daily dosing.
Lots of options depending on the system. Now, you mentioned some surprising recent research earlier, connecting prevention to other health risks. What's the new insight there? This sounds important.
It is, and it's something producers really need to be aware of. It relates specifically to the form of magnesium oxide used in supplements.
The form, not just the amount.
Right. Research, particularly coming out of New Zealand and Australia, has identified a concerning link between supplementing with certain forms of magnesium oxide and an increased risk of salmonella infections in dairy cows.
Salmonella. How does magnesium oxide link to salmonella?
The issue seems to be with coarse-grade or pelleted or poorly soluble forms of magnesium oxide. When these don't dissolve quickly and efficiently in the rumen, they can create a more alkaline rumen environment, a higher pH.
And Salmonella likes that.
Apparently, that alkaline environment can be more conducive to the growth and survival of Salmonella bacteria if they happen to be present.
Wow. So trying to prevent one problem might inadvertently create conditions for another?
Potentially, yes. So the recommendation now, based on this research, is to specifically use magnesium oxide with a very fine particle size. They usually specify at least 200 mesh, which is basically a very, very fine powder.
Why fine powder?
The idea is that the fine powder dissolves much more readily and efficiently in the rumen, gets absorbed better, and is less likely to cause that prolonged shift towards an alkaline pH that could favor Salmonella.
That's a really critical detail for choosing supplements. Are other forms of magnesium safer in this regard?
Acidic forms of magnesium, like magnesium sulfate, Epsom salts, or magnesium chloride, are generally considered less risky from this specific Salmonella perspective because they don't tend to raise rumen pH in the same way.
So it's not just what you supplement or even how much, but the actual physical properties, the particle size of something like MgO really
It
matters.
really does. It raises an important question for producers. Are you using the right type of magnesium supplement? Are you potentially creating other health risks while trying to prevent tetany? Something to definitely discuss with a veterinarian or nutritionist.
Absolutely. What does all this mean for the bottom line? We know sudden death is costly, but is this just about preventing deaths, or is there a bigger economic picture for farmers?
Oh, the economic reality is substantial, and it goes way beyond just the dead animals. Hypomagnesemic tetany carries a significant global economic burden. It's widely recognized as a major cause of death in grazing beef cows worldwide.
Can they put numbers on it?
Sometimes. For example, one study estimated about $13.7 million in lost production annually, just in southeastern Australia alone, from this condition.
That's a huge number for one region.
It is, but the true economic impact is almost certainly far higher than just counting the lost animals. Remember that subclinical disease we talked about?
Yeah, the hidden form.
That silently reduces milk production, lowers feed intake efficiency, hurts overall herd performance, leads to lower weaning weights for calves, plus the increased management time and cost for prevention and treatment. This hidden cost means the true burden is much, much greater than just direct mortality figures suggest.
It's truly a pervasive and costly challenge then, often hidden in plain sight, even when animals aren't dramatically dropping dead. Okay, thinking about everything we've covered. How rapidly and often fatally hypomagnesemic tetany progresses, how complex its causes are, the interference between minerals, the triggers, how easily it can even be mistaken for other conditions. What does this deep dive really reveal about the sort of unseen vulnerabilities in what seem like robust systems? Not just in animal health, but maybe even in our own complex modern environments.
That's a really interesting question.
What stands out to you as the most perhaps surprising aspect of this whole delicate mineral balance, and how might thinking about that change how you or how our listeners approach prevention, not just in cattle, but maybe in any complex system they're trying to optimize or protect?